Yeah, I think the question I get from a lot of patients and just people who listen to this podcast, and I know they have this question as they listen to this. There's like this assumption that these drugs go through pretty rigorous safety evaluation, and they don't fully kind of understand the reality of all this. Um, I guess I want to get your thoughts on, what would be rigorous safety evaluation? Why isn't that considered like the first step in all of this before you even determine whether a drug is efficacious or not? Shouldn't we first determine whether there's like good long-term safety
Sure,
data in the
absolutely.
population
That's
that we're going
exactly
to use the
right.
drug
And
for?
I think just people ask this question like, why don't we have more safe drugs in pregnancy? But a huge issue there is that fetal development, embryonic and fetal development, is so complex that adding a chemical into that mix of embryonic and fetal development will typically alter that development. So it's very difficult to get safety in that sense. This term also, whether something's safe or not, I tend to push back against that because I think it's a more useful model, a useful approach, really to just take whatever it is and address the risks, the benefits, the alternatives, rather than trying to come up with a label of whether it's safe or whether it's unsafe. I think it's much more useful. It may sound silly, but for example, is driving a car safe? Yes and no. I think there's 40,000 motor vehicle deaths per year in the United States. So you could look at that and say it's not safe, but it is safe in the sense that it's something we all do. What's more useful to me than giving these labels is to actually talk about risks, benefits, and alternatives. But we were coming back to like, how should these things be studied? How should they be looked at? And really the kind of study you need is longer term study where you do randomized controlled trials and then have long follow up, because even though you may be able to address one thing or one parameter in a short term basis, you really need to ask questions about whether or not it's impacting long term health. And the reason for that is that these drugs, these medications that we're using, by and large, they're synthetic chemical compounds. And I always make the statement whenever I talk about this, but medications are chemicals and chemicals have consequences. In particular, chemicals have consequences for fetal development. They're going to have chemical effects. So even though with a medication, you may get some short-term benefit in one area, there can often be longer-term harms because there's a chemical impact throughout the body. We see this, this literature better than I do, but with the antidepressant trials that often look very short term. So you may get some kind of a small short term bump, but then you have to ask the question, okay, I'm getting this positive or good result in this one small area. But that chemical, that drug, let's say an SSRI, let's say Zoloft or Prozac, that's not just having some impact in the brain, that's affecting the platelets, that's affecting blood clotting, that's affecting bone health. So really for safety evaluation, looking at these things, it needs to be done with good randomized controlled trials. It needs to be done looking at long-term health outcomes rather than a single parameter. And it needs to be done in particular, not by the pharmaceutical industry, because we know that the drug companies are going to hide the data. They're going to monkey around with the data. That's been shown time and time again. Probably one of the best examples is with Vioxx. Vioxx in the studies, it looked like people that were taking it in the studies were having heart attacks. And to my knowledge of that episode, it looks like they just hid those patients, took them out of the data set so that wouldn't be clear. It got FDA approval, and then lo and behold, what happened when we started giving Vioxx throughout the population is we started seeing heart attacks. That's another thing, and I'm rambling a little bit, but that's another thing the public needs to be aware of, which is that for a lot of this stuff, the public are participating in an experiment of sorts. These things have never been done. We've never altered human fetal development with chemical compounds the way we are currently. So it's basically a fairly large scale human experiment that we're witnessing right now with all of the drugs and chemicals and medications that we're giving to pregnant women. This is like the first time I would say in recorded human history where on a wide scale we expose developing embryos and fetuses to synthetic chemical compounds in this fashion.